So patients frequently want to know what sort of options that we have to provide them with to address their joint pain, whether it be rotator cuff pain or whether it be arthritic pain. And a lot of those options are the same for each condition. So it can be as simple as starting patients on medications, anti-inflammatory medications, similar to what you might even take over the counter. And physical therapy is often very effective in improving patients' range of motion, improving their strength, and addressing the pain and the problem really with no intervention other than the assistance of a physical therapist or even some online training videos. And then there's other options is injections, and those can be typical cortisone injections. They can be injections that we refer to as biologic injections, for example, stem cell type injections. And we do those frequently in the office multiple times throughout the day, and they're usually very effective very quickly. And the pain generally is not as severe as people expect or are concerned that they might experience. Frequently, injections is a one-time thing. People don't often need to come back for more and more injections, as they're always afraid they're going to need multiple injections. And if we get into those types of problems where you're needing more than one injection or you're not responding to the physical therapy, the other medications, then you start to be moving into talking about surgery options. And those really only reserved for patients who have very clear problems in terms of a torn tendon that can be reattached or a very arthritic condition that has to be replaced. And otherwise, for most of the chronic conditions, it's someone who's been through all the other steps of medications, therapy, and injections before we get into surgeries. And the majority of what we see can really be done through an arthroscopic surgery if it comes to that. It's surgery done through smaller incisions where we're putting a camera in the shoulder and doing the surgical procedure watching on a monitor. So, and that's a same day outpatient type of procedure. And so we offer all of those here in a sort of a stepwise progression. And fortunately, most of the people that we see get better with the lesser invasive options.